All right, well, welcome to Transnormal. We're here with a lovely guest and, of course, my co-host Laura. We met, of all places, we're both American, but yet we met abroad. We met in Amsterdam. And it was a really interesting meeting. I'm just sitting at the bar, and the bartender called me over and introduced me to you. And I was so excited, and we had such a lovely conversation. And so, because of that conversation, I really wanted to have you here, and hopefully we can talk about some of that same stuff that you mentioned. And I thought it was a really good perspective to have. So if you don't mind, just go ahead and introduce yourself and give us kind of a who you are and what you're all about.
Awesome. Well, it felt so serendipitous, and it was so fun to meet you and hear your story. And I knew of you, it was heartbreaking to hear kind of what you're going through. And so I am so honored to be on here. And I think that advocacy and, as you said, like the name of your podcast, normalcy, is really important within the trans community. So I am just a very normal family doctor, and I've been practicing full spectrum family medicine for almost 10 years now. And it is very normal for family doctors to provide hormone therapy. And now it's actually, I should say, it's very normal. So back 10 years ago, it wasn't part of my training, but I just had the wonderful opportunity with one of my senior residents. She brought in this panel of trans patients and introduced to us gender-affirming care. And that was at a time when it wasn't standard training, so you really had to like seek out that education, unique spaces. And a lot of that education was based on just, which is really disgusting to think, but it was just about like validating people and like making safe spaces for people. You couldn't even get to the healthcare of what people actually needed, which it's heartbreaking when in a society that we have to spend so much time just explaining why someone deserves to be in that room. And then 10 years on, now I've been a medical provider for 10 years. I delivered babies for 5 years. I was a hospital doctor up until a year ago. Now I'm a hybrid. I hold an administration position in my clinic as a medical director, and I work in a federally qualified health center, which means that we see everyone regardless of insurance or race or gender. Our doors are always open. FQHCs are a pretty standardized clinic that exists all over our country. They're kind of like the backbone of the healthcare we provide in rural towns and in cities. And I had the opportunity to bring gender-affirming care here when I started 10 years ago. And now we're 10 years on, and we have a robust panel. Like, I think we serve like 11,000 patients, and I would say we have an appropriate collection of people from all different walks of life. And thankfully, gender-affirming care has improved a lot in the last 10 years. So.
Yeah, so just to give our viewers or our listeners some perspective. So, Joe started to talk a little bit about your meet cute in Amsterdam, and I guess what I really want to get into, because you mentioned you're a family physician and you're someone who provides care for, for all sorts of reasons. So as a family physician, you're seeing patients with all kinds of problems, whether it be well-person care, regular checkups, screening tests, but also any disease or any condition that might have. And one of the important parts of your practice is that you say that you have been involved in gender-affirming care. Now, do you mind if I'm asking, do you see patients like across all ages? Because I know some family doctors limit their care to adults. Some family doctors will actually see the full breadth of families, including pediatrics. So what does your practice look like?
So when I first started, it was, I was seeing mainly adults, and and if I had any minors, and we have the gender clinic, which allowed us, because it was so early on that like oftentimes when you're working with minors, you're talking about puberty blockers. And so if minors had not gone through puberty, we would usually refer them to our gender clinic to get puberty blockers. And family docs are usually not certified to give any kind of puberty blockers. You usually have to work with a specialist endocrinologist. In the rare event up until very recently, if I had a like 18-year-old, 17-year-old that had pretty much completed puberty, and they kind of met criteria for persistent and consistent gender dysphoria, and had good family support. We would talk about starting hormones. I've only kind of did that. I only had like really, I think one patient who fell into that category of really, we felt from a kind of qualified where they had that persistent and consistent gender dysphoria. And we felt that it was after, doing all of our appropriate kind of like psych evaluations, we felt that they met criteria to start hormones.
So just ask you, like, go ahead.
Yeah. I was gonna say, but we are in a position now where our hormone care was shut down because as an FQHC, you were held under the Trump administration's changes. And so with the executive action that was passed, we are no longer able to provide any care to minors. And as of October 1st, we're actually no longer provide any trans care at all.
So, I do want to get back to that because obviously we're living in a very dynamic world in terms of what the laws and around reimbursement is. But I want to hear a little bit more about your background because I was reading your biography before. So when you started your practice, how comfortable were you at that time, like taking care of trans patients or people who might have come to you and confided in you, either that they are trans or that you recognize were trans, or people who were having, let's say, some symptoms of dysphoria? Like, how comfortable, like, what piqued your interest in this, I guess, is what I'm asking.
I think it was the introduction I had from a senior clinician, one of our senior residents that had kind of like really spearheaded, we need to teach our residents how to practice gender affirming care. And I had a brief introduction, and then I graduated, and a lot of family docs, what often happens if you don't get it in 3 years, you've got to get continuing education. And so I had one of my patients, when I first started practicing, she came to me as a trans female, and she wanted to start hormone therapy. And she was one of those incredible patients, which 10 years ago, and we still have this, where as a trans individual, you had to do so much homework on your own. And so she came in so well informed on what the therapies were, and we used a lot of in the beginning stages UCSF, UC San Francisco, which tends to write a lot of like the
guidelines,
kind of like the guidelines on it we'd follow. And she knew from like insurance coverage, and I was really transparent with her. I was like, this is an area that I'm really passionate about learning more about, and if you're comfortable, I want to learn together. And so I did a lot of additional CME classes and courses.
So continuing medical education.
To try and kind of like get myself up to snuff. And this is kind of a thing in medicine that if you kind of know the ropes, it's kind of like learning languages. If you learn one romantic language, you can kind of patch together another. So in medicine, we're constantly learning new techniques and ways to do things. And if you just do a little bit more education, you can pretty much apply previous knowledge. And so once I got over my kind of comfort level of how to prescribe hormones, it's a pretty user-friendly model. And that's what I often encourage all of my providers that I teach residents still. And I'm like, this is really easy. It's just like hormone replacement therapy for menopause or hormone replacement therapy for hypogonadism. It's when it comes to hormones, it's pretty straightforward.
Yeah.
So from the medicine itself, it was really easy to learn. And then, and so when I first started, it was just kind of getting comfortable with prescribing. And then and after I took a bunch of courses, I was able to advertise that I provided them the peninsula. I was one of at the time, the only physicians that provided that at the peninsula. So it was, and that was really important to me too, because we had a lot of people traveling to Seattle to get care, which was just really inappropriate. Then about like 3 years into it, Planned Parenthood became much more trans friendly and started really providing gender affirming care. So that became another outlet in the community. And now obviously 10 years off.
So in your practice, were you sort of the person who became identified as, I'm the person who provides trans care of all the physicians in your practice? So like when you first started you mentioned that the first trans woman who came to you and kind of gave you a little bit of a startup of your education. By the end, you become sort of identified as a provider and probably also as someone who is receptive, because I know as a trans person myself, obviously, is that one of the things that we're always apprehensive about is when we see a doctor, especially if it's anything where we might have to disclose our trans status, is you want to find someone who is who is identified as this is someone I can trust, who is going to understand my situation, who isn't going to misgender me or make inappropriate comments or make an assumption. Yeah. So I imagine at some point you get a fairly significant collection of patients. So like at what point, like how many patients would you say that you're taking care of with sort of dysphoria issues or trans care at any time?
I would say at full strength, I think I was at probably like 30 or 40. And then because I have always been open to any of our trans population, even though I closed to a lot of the people. It was like, because I was the only provider, I was always willing to take additional people. And then once we started a residency, and I was able to train a lot of young providers. And
so you're bringing other doctors in to learn from you about how to do this type of care.
I usually when people would prefer, like I had providers in the community that would reach out to me with interest, being like, I really want to be able to provide this care. And I would always just I'd demystify it. I'd be like, this is actually really easy medicine. It's the things you already know. You just need to reapply it. And we talk about, and then I think along those times too, and again, context is important. We are a very rural town, so we are often we still have a local newspaper, and so we're often 10 years behind the curve. It was just kind of having to still give education about proper pronouns and breaking down a lot of preconceived ideas about what is and isn't okay when it comes to trans care. And but I would say up until just last year, we would, on our intake sheets, we'd ask preferred pronouns, we use preferred language. And so we had improved so much the last 10 years so that patients walking in our door in the community just knew that no matter who they saw, that they felt very comfortable to be transparent with the provider they were seeing, that their genders were going to be preferred, that pronouns would be preferred, and they would get really good care. And that was always, it's been a huge, it's been really important to all of the providers that work here.
Yeah.
And I will say, a lot of times when you, there's kind of funny spaces, but when you work in healthcare, it does tend to cater to providers who are very inclusive. A lot of my providers walk around with lanyards and rainbows and stickers, and it's just so they're very they're very they their preferred pronouns on their just kind of pins, and so it's a very gel environment that that has had to change a little bit. We don't have to cover up who we are, but I think that it over the last 10 years has become so inviting that I didn't have to be the other one that did it. So.
And if Joe, if you want to get a question, you just raise your hand.
I know, right? I'm just fascinated. My question would be, of everything you just described so far, what was the biggest challenge that you ran into, whether it was other people training them or you learning it? You kind of described it, but was there anything that became a big challenge? Or was it not until the more recent political climate?
I think that it's insurance companies. I think that was, it's trying to validate, obviously insurance companies are the last in the scene to understand how to do something. And so even though it's, and I think they're surgical lists, that's another one that's kind of funny. When I would get a lot of surgeons that advertise, now they're comfortable. 10 years ago, they didn't want to advertise they did certain procedures, and so you just had to know, you had to have the in crowd, and I would keep these surgical lists with me that would be I don't know where to refer this patient to, and so finding surgeons and then finding surgeons that took insurance, and then having to sync up with some of my patients. We just knew certain insurances were intentionally obstructionist, and so we would change insurances to try and optimize care. And
you're talking in terms of covering procedures or
covering procedures. Yeah. Hormones are cheap. That's never been an issue. But procedure coverage, affirming surgeries, things like that. And then,
Wait, are you saying that insurance companies aren't just shilling these surgeries on people to make a bunch of money? They actually are refusing and
they
not
refuse.
wanting it to happen?
They refuse, unfortunately, most procedures. It is really hard to get a hysterectomy if you haven't had 5 children and you have no, medical reason. You just want one. It's really hard to get.
But I
And
thought they were making a bunch of money off of,
Well,
transing the
not the insurance
population.
companies.
Right, yeah, yeah.
The insurance companies want you to do as little as possible.
yeah,
Us doctors want to do things because that's how we make our money.
Right.
But
yeah. So I think that, it was like insurance getting things approved, and then it was, and this is still an issue. Is like these letters, like the letters that you had to write for patients to validate procedures that I don't have to write. I can order hysterectomy for anyone and not write a letter of validation that I'm going to provide post-op care. But, and it's just is, and we know that in medicine that, just hurdles you have to jump. And I think that I was even just telling my residents the other day, it's really funny. The 2 hurdles I find myself having to advocate the hardest for are my HIV positive patients and my trans patients. And it honestly probably is just the fact that it's just they tend to still be really kind of like unknown territories where I know a lot of people are probably barking up the tree about diabetic access and things like that. But I usually have to get on the phone and really shake trees to get things done.
So, the way, you're discussing patients, it sounds like you're a very accepting and very affirming patient. And I'm assuming in the time that you've been in practice, you've been practicing more under sort of a purely affirming model where if someone comes to you and says, I'm trans, or I believe I'm trans, and I want hormones, or I want therapy or surgical interventions, that you're operating mostly on an informed consent type model. Like if someone says that I feel this way and I think that hormones are going to be what's best for me, or this surgical procedure is going to be what's best for me, is your practice such that you would generally just say, like, yourself best and let's go ahead and do this? Or do you, I guess what I'm getting at is, when I came up, which was 25 years ago now, I came up through a gatekeeping model, which basically meant that you had to go through counseling and demonstrate your seriousness and your lack of sort of other, or at least make people feel that there weren't any other competing reasons why you were pursuing, and sort of that you were trustworthy and weren't going to do something crazy before you get your hormone prescription.
You had to socially transition before you're allowed to have hormones.
Yeah, so when I did it, we didn't make a socially transition, but they wanted to know that we were on a path to socially transition. So, but I did have to get like 13 weeks of count, like, an hour a week for 13 weeks, and a letter from my psychiatrist before I was able to get the hormone prescription. And I went full time, like probably like 9 months later, but still. Whereas now, I know, and obviously every practice is different. I know a lot of people practice under this sort of informed consent model, which basically is that if you say you're trans, then we take your word for it. And if you say you want hormones and feel they're in your best interest, that as long as you understand what hormones do and what they don't do, you get your hormones. Is that sort of...
For adults, that is generally, I mean, I guess like, any physician or medical professional is going to kind of like look at the whole picture. I mean, I've had some patients that have pretty complex mental health histories. I think anyone that works in an FQHC or those clinics that tend to be a catchment for any patient, and you're gonna, and not that that's for an adult, because again, you can have profound mental health abnormalities and be trans. It's not like,
of course,
like have profound mental health abnormalities and be diabetic. And so I think that we tend to fall in the category of like persistent and insistent thoughts. And so obviously if somebody comes in acutely unstable and manic, you're not going to make medical decisions because they can't, and you're following like that usual consent law, like they can't give, because you've deemed them incompetent in that acute mania. You're not going to do surgery on them, just like you're not going to give them like treatments. But that's like, it's such a weird setting where I've got somebody, I'm not getting somebody who is like, I'm deeming incompetent incompetent and mentally unstable, and
Yeah.
that I've been into trans care. That's like never like a reality that happens.
But even just like in the adult world,
Yeah.
even if someone's not necessarily mentally incompetent, or their thought is so disordered that you know that this person has that issue to deal with first.
Yeah.
But are there ever situations where you're like, I don't know if this is the best for you, or maybe we should think about this first, or I would like to see something over the next few months before I feel comfortable doing this, or
Not with adults. I think with adults, when I was a younger provider, I was maybe a little more, I would say, hesitant. And but I think that as I've gotten older as a physician and felt pretty comfortable with the medicine, if I've got an adult who can give appropriate consent, there's no reason to withhold medical care. And that goes across the board with like anything. Like, do I trust them? And it's even like other big things, like, for example, HIV treatment or Hep C treatment. Like I'm like, oh my God, you're about to get some really expensive drugs, and you need to be clean to stay on these. And, are you going to follow through? We may not. If you don't follow through, I may not get access. We're constantly, and that's what doctors do, is that really push relationships with patients, and they're able to like decipher. But it's only with minors that I find myself where we will provide pause, and with minors, and the reason being of just like a developing brain, and that in those situations, I have had minors that have come in and they're like, I'm gender dysphoric, and I would talk about like, well, when did this first come up? And they're like, well, I've met some people this year, and I think that's how I identify, but we've got pretty good indicators. This has like never been an idea before, and it's a really new concept for them, and so we do a lot of talking in those situations, and we do a lot of visits, and we do a lot of talking, and usually we do some kind of like long exploration, and I usually will, with those kids, and again, I'm usually seeing them at like 17, 18. If they hit 19, where I'm like, hey, you are now considered an adult, you make these adult decisions, but looking at for a while, I will usually we'll spend a lot of time talking about the irreversible effects of things, and exploring. And again, like, our generation of kids is really different right now. So, and I have also recognized that I have these, just like with like any condition, we have the cultural influences of the generation. So I've got my older trans population who very much live in a cis world. They're like, I am male, I'm transitioning to male, and transitioning. I've got my younger generation, like my 20-somethings, who are like, I live in a fluid world, and I want a mass or I want a femme, and their intention is not necessarily to like sit
or transition.
Yeah. And then I've got my young kiddos who are just like, I'm just being introduced to this, and I don't know if I live in this world or not. And so we frequently, so for my young kiddos and my like 19, 20, 21-year-olds, where they're coming in, they just kind of, they're trying to like learn the language about, they think that they're gender dysphoric, they're not quite sure. We do, what I kind of do is I do some education, and I'm essentially, just like if I were to have a person that came in and said, I think I've got asthma, or if I think I might be depressed, and we talk about, okay, what's the language around that? What are the symptoms of that? And so I put something called the Gender Unicorn, and which allows you to kind of do some self-discovery, and just kind of like some abridged counseling. I would love if like any kind of, unfortunately, we don't have a lot of counselors on here who are like really proficient in gender care, but about like trying to get the flexibility. Sometimes I come back, like I did some self-discovery and actually discovered that one of my patients the other day, she came to see me when she was 19, and she came in, she said she felt like she was identified male. We met a couple times for a couple months to talk to the gender unicorn, and we kind of explored it. We never really started anything, just sort of talked about it. And she actually came to see me just the other day, and she's now 22. She never like, she kind of swung back to female, and actually talked about it. And I was like, she was like, I remember coming to see you when I was young, when I was like 17, 18. I was like, yeah. And she's like, and I came in and I felt like I was possibly trans. And I was like, I do remember that. She's like, and I was like, tell me about that, because I know obviously you didn't, you look for good, but I realized that she's kind of an impressionable personality. And she's like, I realized that actually I'm just more of a tomboy. but a lot of people were talking about being trans, and I didn't know that's where I lived. I was like, and that's again, it's like that's what doctors do. It's like they kind of the goal is to help guide a person, not really putting up, not guide them to a decision. The goal is to like inform them with information in language and let them sort of to so.
I think that's really important what you're saying, Jessica, because I mean, really what we're here is trying to dispel kind of some of the crazy rhetoric that we hear around care. And so having someone on that just talks about it in plain language like you're doing and like, hey, this is how we do it. I think it's refreshing to hear that there are times when you're hesitant. There are times when you prescribe time, right? And you don't give someone hormones. There's all these other factors. And I think, unfortunately, the kind of caricature that's been made of gender affirming care in the last year is someone, and maybe, they've said that there's examples where this has happened, but I think it's important that it's not the norm, that someone comes into you and says, I want hormones right now. You're going to be like, let's pump the brakes. Do you know what they are? Do you know what gender dysphoria is? Like, you still kind of go through the whole gamut, which I find really refreshing. I think listeners will love to hear that you are hesitant when it comes to minors. And when it comes to adults, it's like, well, if they can make these other medical decisions, then they have the informed consent to make this decision as well. I just make sure that they have the information they need, which is a lot different than what you see, unfortunately, in the Twitter sphere about gender affirming care.
Yeah, and I think it's important to also like anything in healthcare, like it's important to remember kind of like where we came from, and kind of like it explains kind of why we're here, in the sense that like we came out of an era where to recognize that you are trans and want gender affirming care, you had to fight every step of the way. You had to you had to be brave to walk in the building. You had to be brave to sit in front of a doctor to say, this is what I want. And then you had to be brave enough to educate that, to not like be shamed and othered, and then to like advocate for yourself. And there was so much like frontal catalyst. And I think in the medical community woke up and was like, okay, how do we respond to this? Let's be very available. And I do think that I know there's like providers out there that would like never step on the feet of like trans people. Like they know what they want. Do not be obstructionist. Like, validate what they need. And naturally, as pendulums nerve, you have these kind of extremes. I think that, and like now that we are so far along on this journey, I think that we've very comfortably landed in a space, at least in my world, and I can only really speak to like the world, which is a rural community, is that we've landed in a space that is, it's very much normalized. Gender affirming care does not, you don't have to be like the fanatical, ally. You don't have to also be that obstructionist provider, that like this healthcare is normal healthcare, just like treat anything else. Like I have people that seek, and they want, postmenopausal women that want hormone replacement therapy for very valid reasons, and there's risk associated with that decision. And my job is to like make sure, like, do you know that there could be a risk of breast cancer? This, I don't care. I'm like trying to murder my family and like melting through my skin. I want hormone replacement therapy, and you're like, and it's never. So I think that we as physicians are always educating people on the risk of the choices they want for their healthcare. Sometimes we're begging them to start healthcare, just like begging them to start selecting the diabetes so out of control. Sometimes our job is to give them a bit caution because they are deciding for treatment, like a GLP-1 medication for weight loss, or for replacement therapy for hot flashes, or cosmetic surgery. It's like there's so many different times where kind of our job is to really be that sounding board and to like interpret the medical knowledge in a way that we are considering their values and their lifestyle, risks, navigate leading to that, and that's different.
So, like one of the things, like, that, when you talk about sort of, gender care being like any other kind of medicine is, I practice medicine, although I practice obviously a very different kind of medicine. I don't do any gender care. Obviously, I have some trans patients who work their way into my clinic, but, we do a lot of shared decision making. Mm-hmm. So just, I know what this means, but just for our audience, this is where, you might have some idea of what the optimal therapy is, but you present your patient with a bunch of options. You tell them like what you think the benefits are of certain ones, what you think the drawbacks of the certain ones, and then often based on what their preferences are, like some patient, like I know I treat inflammatory bowel disease, and I have some drugs that are very effective that maybe have a different side effect profile, some that are a little safer, but they may not work as well as others. And, some of my patients really I want the drug that's going to make me feel the best, the quickest. And some of my patients I just want something that works, but I don't want anything that might have any side effects. And a lot of the times the decisions we make may not be the ones that I would make, but it's based on what what we often call their values and preferences are, that they really value safety over effectiveness, or effectiveness over safety, or maybe there's one that comes in a pill and one that comes in a needle and they're really scared of needles, those types of things. But at the same time, there are limits to shared decision making, which is that if I think something, let's say, is harmful to someone, even if I don't think that medication is harmful broadly, but just think for you, I'm worried that if you take this, you may be at higher risk than other people of developing a complication. Or I start a medication and I can see they're clearly deteriorating on that medication, even though it might have been the thing they wanted. I feel an obligation in those situations to be like, hey, I'm not prescribing this for you anymore because it's clearly not helping you. Or I think we should make another choice because this is clearly not helping you. Now, I know one of the conceptions, and I recognize different people practice differently, is that around gender affirming care, people often get this impression that we give people hormones and, obviously people do better, but we also know that maybe there are some people who do worse. And I know it's hard often to say what worse is. Does it mean your mental health is worse? Maybe you've lost your family. Maybe you've lost your job. Maybe you've experienced a decline in your economic status. Is there ever a point where you sort of have like a level setting talk with your patients, be like, I know this is something you thought you wanted, but it sounds like things are deteriorating mental health wise. Maybe we should reconsider. Or are you more the type who's like, well, if this is what you wanted, this is what you're getting. And if you say that, well, at least my gender's straight, even if all these other things in my life are falling apart, I'm going to keep going. So do you have a role in helping people or in putting your foot down ever?
Yeah, I think that the times when I put my foot down, it's often because of like medical complications. So I do have, for example, I have several trans women who are older. They're over the age of what would be menopause, and they've had cardiac history. And we do know that hormones can be dangerous. And sometimes I have people that want to use, for example, like injectable estrogen, which is a little bit riskier than it allows you to go higher in your dosage than you would for oral. And those are times where I've said, this essentially is a contraindication for you. We may not get the feminization goals you're looking for, but because of your medical history, I don't feel comfortable prescribing such a high dosage. We don't like pull back the medication, but we're like, considering the full picture. I have sometimes, I think it's really natural. People get really excited when they start gender affirming care. And so they do think that sometimes it's all dose dependent. And so I sometimes will have my young ones that are like, if I use the highest possible dose of testosterone or estrogen, it's going to go faster. And I'm like, no, it's not. So it's a lot of expectation counseling about what do you expect to get from hormones? What are they going to do and what are they not going to do? And I do get people that, will do some home research and or like early on, for example, progesterone we didn't use a lot of it. And then there was I had a couple patients that would come to see me before I started kind of using it. And they're like, I've researched this and I want to use this. And I would have to be like, I have not researched that. And I need to do a little bit more research before I feel really comfortable knowing kind of like how to treat this or how to dose it. And we would clarify like, what are the intentions? What are the goals from this? And people would say like, well, I read that it's going to help with breast development. And, we have a lot of that just shared decision making about like goal setting and things like that. When it comes to, so I think they're kind of like multifactorial when I adjust care. So it's underlying medical conditions. There is a mental health component, and it's not so much that when I've dealt with challenging mental health factors that I'm taking people off hormones. I think when I'm dealing with challenging mental health factors, I'm dealing with and this is something I think that I see more in my patients that have been transitioned for a long time, is that, and I talk really openly about people with this, dysphoria is not something that can be medically shunned away. There's no amount of hormone or surgery that can sometimes silence dysphoria. And I have some patients that struggle with dysphoria in the same way they struggle with depression. And I think of one of my most heartbreaking dysphoric patients. I met her, and she's actually one of my, she is like a poster child for what every trans woman wants to achieve. I walked in the room the day I met her, and she was breastfeeding her son. She passed in a way that she was doing the most feminine act ever imagined. I mean, and she had some of the worst dysphoria. And it was always so heartbreaking, because I was like, you're literally breastfeeding your child. I mean, she was able to not only grow breast tissue, she was able to like learn to lactate and sustain the life of her son. And she still struggled with just like an evil amount of dysphoria. And she often sought lots of procedures to try and deal with this dysphoria. And we often would have to talk about and much like patients that seek a lot of cosmetic procedures to like look a certain way, that there's always that conversation sometimes you have to have where, when is it enough? Does there come a point in time, like when do you feel satisfied for whether you are passing appropriately? And we would really openly talk about that. And is the answer not to get the procedures? Not necessarily, but it was always really important, I think, when, because again, she's an informed adult, and I'm not going to stop her from seeking, and she was never doing anything that was like terribly harmful. Like I do have, every now and then we have patients that seek a lot of cosmetic surgery, and
like cosmetic and all that kind of,
it's a whole other issue. Yeah. But it's like, I think that's where I think understanding that trans care isn't just, it's not just like getting the hormones, getting the surgeries and passing. It's just like understanding the gravity of living as a trans patient, as a trans individual in our community. And that's just a battle that I know patients, and even like patients of mine that like when they would find themselves falling off treatment, it's hard to show up every day. It's hard to show up every day and to step into your true self and to have support of people around you and deal with adversity, especially if you don't pass well. And I'd have some patients that would just would take, I don't want to say like breaks from it, but they would just make it's just easier to hide for a little while. And that is, and so we talk openly about that. And I think and anyone who does trans care and knows that is a lot of the plights that a lot of their patients have to struggle with.
Yeah, no, that's all very relatable. Like as I mentioned earlier, I've been at this since around 2000, and there's still those moments where you're like, I'm just not feeling it, or where you have to feel you have to be on all the time, because if you slip up once, then everything can fall apart. So I totally get that pressure that, Now, I don't, this may be just semantics. I don't describe that as dysphoria, because like my experience with dysphoria personally is very different, but there is a sense of not wanting things to slip. And I don't know what the right word for it is, but you're right in the sense that no matter how long you've been at it, it's always at the back of your mind about like, if I let my guard down for a second, everything that I've worked for could come. Could come falling down. So I have one more question because I do want to get on to kids. But one of the, when I think about what's going on in the world, and we hear a lot of concern, often being expressed, obviously, by not trans people, and often by women or people who are claiming to speak on behalf of women about the dangers that trans people, or at least some trans people, might pose in, let's say, women's spaces or in women's environments. Do you ever take pause, when offering therapy? Let's say someone, and I don't know how often this happens in your practice, who has a history or a tendency of, let's say, being someone who has caused harm to women, who has a criminal record, or who has past behaviors that you would view as being sort of misogynistic or destructive to women or coercive towards women. Do you ever recognizing that in Washington State for sure, but in many parts of the country, that hormones plus self-identification is often sort of the keys to the car in a sense of getting legal status to womanhood. Um, do you often take pause before sort of medicalizing someone like that, even if they are dysphoric and you believe they are dysphoric?
I have not. I have not had. I've not had a patient that fits that category,
Sure.
so I've not crossed that boundary before. But trying to think of, but unfortunately, I do take care of patients in the queer population who are women who've, I mean, like women can harm other women, and
For sure.
they can be the abusers in a domestic violence relationship, and I have had women who I've taken care of who are the abuser, and
And you're talking about natal women here.
yeah, yeah.
Yeah.
So I've not been in a position where I've ever had like a trans female who has been who has like a history of misogynist behavior that steps into that space. So I don't even know how I would.
And, if it hasn't
Yeah,
happened in your practice, that's,
yeah,
on one hand, that might infer that those kind of situations are uncommon, even though they often get played up in in the media.
I think it's like well, it
Especially
kind of brings in
medicalization, because like that's if it's someone who's purely trying to be a predator, right? Like that's a lot of effort
it's a lot of
to
effort.
get medicalized and to go through all of that
Yeah,
versus
I think
just identifying, right, and not doing the medical approach at all and just walking
yeah.
in, right?
Yeah, I think that I think there's like I think that's kind of like the boogeyman idea that like somebody's gonna come in and like I know there's that one like I did hear stories of like some social media guy who like posed as a trans woman to show how easy it was or something stupid like that. And I'm just like um it's like a really I think that much like we talk about irreversible effects, like it's a big deal to step into that space. I know it also makes me think of like the bathroom argument idea where like these bathroom bills, if anything, that what they do is actually go after like the average population does not realize that a trans woman does not stick out. They don't glow. It's not like you can they look very femme 9 times out of 10. And if
Yeah.
anything, the bathroom bill targets more gay women who look too butch than anything.
Yeah.
Yep.
And that
Yeah.
so I
Yeah,
think
I met
that's
a
what
woman who got yelled at, and they had called the police on her because they thought that she was trans and she was just a masculine presenting woman,
yeah.
like a
Yeah.
typical like lesbian from the 80s kind of look,
Yeah. No, and
Yeah.
that's actually who's getting more who are
Yeah,
getting
the
more than anything.
Yeah,
backlash.
and
Yeah.
totally get it. Like, I know a lot of people, especially in social media, they're like, I can always tell what a trans person is, and it's like, well, of course you can guess, you can see the ones you see, but you don't really know what the denominator is. You're not catching all the ones you miss,
Yeah.
No.
and
And I will inform people that like a lot of that I don't think people really understand that like even physicians can't tell. I mean, I've got like much like my patient that I met who was breastfeeding in a room. If you would have
yeah,
been like, go see this, if she didn't, if it wasn't in her record, I would have been like, what are we doing? Like, that's like, I mean, we are so incredible. Medicine is so incredible that it has the ability to powerfully affirm somebody in such an incredibly passing way that even I, as I guess, a specialist who's worked with this population for a long time, cannot even tell 9 times out of 10.
Wow.
So I think that I think that's what gives me a lot of hope in the sense of what we're working with because I think it allows people to stay safer. But what it does is it targets anyone who doesn't fit a feminist idea or a masculine
Right.
idea
Doesn't fit some
and
sort of image.
preconceived.
Yeah.
Yeah.
Shifting gears a little bit, and you let me know if you don't want to talk about this, but when we were
Oh,
in Amsterdam, you told me about your child, and I wanted to kind
well,
of explore that again with you because you mentioned how when it came to your own child, some of these decisions became a lot more difficult for you, even as someone who practices affirming care. Could you just walk us through whatever you feel comfortable with that kind of like storyline about your
yeah.
child and how they identify and all of that?
hmm Um, And yes, he does. So he is, and we talked kind of a little early. Yeah. So he's stealth. He is not out within his whole community. Um, it's just like the craziest story. So, he was in preschool, and I was approached by his preschool teacher. And I'm a pretty regular parent, I feel like, with like pretty regular ideas. And I think like all at the time, my partner and I, who we've since divorced, he was our firstborn, and our preschool teacher came up to us and said that, your child is, your daughter seems to be kind of like not wanting to do a lot of the girl things. And I was like, what do you mean? He goes, well, she's like, it's my fault because I'm often breaking up the girls and the boys into groups. And your daughter always wants to go with the boys. And I was like, well, that's funny. And I was like, she is kind of turning into a tomboy, it's kind of like, she's like, yeah, I just thought I'd bring it up to you. And we didn't really we kind of laughed it off, but didn't really think much of it. And then I spent a lot of time talking to I'm trying not to use like identifiers, my oldest, and we talked a lot about what it meant, like any parent would do, like, okay, what is gender? Like, and I was trying to like promote like powerful women. I'm like, maybe they just think that like girls are dumb and they don't really identify with the girly girl. And I knew that they didn't. And so I would talk about like how amazing girls are and how powerful they are and how like they can do incredible things and you should be proud to be part of this club. And they were like, no, I'm not. And they kind of were always like, oh, whatever, and didn't really have anything. But they became very interested in different, who was a boy and who was a girl, and what made a girl and what made a boy a boy. So I would constantly be asking questions, and just me and my naivety was like, well, girls have girl parts and boys have boy parts, and like, and they were just like, that doesn't make sense to me. And we're constantly kind of pressing this idea, and as the year kind of progressed, and our preschool teacher continued to sort of say, I wonder if they have some gender dysphoria. And I, again, like I was a doctor and I thought it was like, I was being told by like.
And were you already treating like trans patients at this point?
I was treating trans patients at this point. Yeah.
And so it wasn't completely unfamiliar to you. Yeah.
Yeah, exactly. And I was just like, what? And I was like, am I being told? Am I such an absent-minded parent that my preschool teacher has to tell me what I don't already know? And so it was that funny moment as a parent where you're like, have I not been paying attention? And she was very sweet. And she's like, I'm going to recommend a book for you. And much like you, and this is actually how I coach parents now too, that are in this position. And she recommended My Transgender Child. And it's this like really lovely book. And it just very delicately talks about what this could mean, what it means to have gender dysphoria, how to discuss it in a medical way. And I was like, do you think this is even possible? And I think my partner and I were just sort of like that, in a very normal parent response. We're like, no, do you really think it's possible? And then we started to kind of explore it with my oldest. We would say, and I tried to change how I talk about gender a little bit. I'd be like, sometimes people are born and they're told that they're a girl and they're really not a girl in their heart. And sometimes people are born, they're told they're a boy and they're not really a boy in their heart. And so we really rephrase gender. And so we did a lot of just education, and we let my oldest just figure out like kind of where, without like pushing them in any way, like where they felt like they fell. And then we also tried really hard to remove genderfying, like kind of like images from our like home. And so we bought a lot of masculine toys and feminine toys. So we had like Barbies and dinosaurs, and we provided really gender fluid clothes. So everything from like tutus to like army clothes to like everything. And we just sort of created like a really like very wide bumpers to allow exploration without any kind of like guidance, and just provided education and just like an open playground. And after probably about a year, it was apparent that they really preferred masculine things, and 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 were gravitating towards that, and really actually would shun anything feminine. Would like get to a point where like temper tantrums if there's asked to wear anything feminine or play with a feminine toy. So much so that even the elastic band on a pair of Carhartts, like Carhartt pants, like khakis, were too feminine to wear. And it was like we were obsessed, and and they started wearing bow ties and ties, and just like really trying really hard to like say like, do you not see who I am? I am very masculine. And so, and around, it was around the age of 4 where we realized we were not using the right pronouns, because we'd be having a very civilized conversation, my partner and we would use she, and my oldest would like start screaming at us and would be like, stop talking about, I'm not that way. And we'd be like, I'm a boy. And we'd be like, we know, honey, we know. But I would be using she, and he would hear it, and he's like just basically so upset because he was being misgendered. And I was like, and finally I was like, oh my God, I'm like misgendering this child. And that's why he's getting so upset. And so at about age 4, we decided it had gotten so bad that they were starting to like refuse to bathe because they didn't like the way their body looked. And we had gotten like, we were definitely had like stepped very far away from anything that we could possibly identify as feminine. And we still think he still had long hair at that point in time. I was terrible, like a new mom. I was like, it does hurt when you cut your hair. He had the most beautiful hair, like just like ringlets of blonde. I was like, I don't want to cut them off. But
Did you ever think that like this isn't true, or like
100%.
they're gonna grow out of it, or like
yeah, 100%. I was
it's
like,
a
this is a
phase?
phase. I just need to get the language into you that you understand that this is just a phase. Like we're in a phase. And and then we kind of decided, we're like, let's just try. He was getting so upset that I was like, let's just try to do some really simple, kind of just try some pronoun changes. And so we had a small enough world where we told our family, we're like, we're going to see if they would feel more comfortable being referred to as male. And so we told our family, and that we want to refer to him as male. And we told preschool. We have a tiny little town. It's like pre-COVID. And we were just to kind of see how this feels. And it was like, I took him to a store, and I let him buy anything he wanted in the store. And it was like Old Navy. And he went right to the boys section and bought like all the boy clothes. And we were starting the second year of preschool. And I was like, let's go shopping. And so he showed up to preschool, and he was able to use male pronouns in preschool. And he had his boy clothes on. And he was like glowing for like the first time. And I think and even in my mind, I was like, this is just a phase. You know, I was like, we're gonna.
And all you did was clothing, pronoun, and
Clothing and
cut
pronouns.
hair?
Yeah, cut hair. He got lice, so we had to cut his hair.
Oh.
So it was like,
So even that wasn't necessarily intentional. That was
Yeah.
just happenstance.
And I cried. He was totally happy with it.
But at that point,
he was
you
I'm just like,
had registered in school.
Oh, go ahead. What did you say?
I'm sorry, but you had registered him in school at that point as a boy, and told the teachers in the school, and the school was.
Yeah, and we're talking like, it was like, it's his little preschool that's like a 1-room classroom with like 12 kids. But yeah, we did this like very gentle affirmation in a very soft way. And it was basically, I was like, let's just try this. And we're not breaking anything. We're not, we're giving him just some space to kind of feel if it feels better. And then my partner and I like hit the research hard. We were like, okay, we have to get out in front of this. And so we were, as far as like, we've got to figure out what it means to be a trans child. Are we dealing with it? Is he trans? What does his future look like? I mean, and then there's the panic that like, I think any parent goes through. Like I had my grieving where I was just like, I thought I had a little girl, and I had all these ideas, and I had to break those down. And which I think is whatever any parent who's had all parents have preconceived ideas. Like, I thought he was going to be a varsity football player, and turns out he loves theater. It's like we all are dysfunctional at being a parent in our expectations. And then it was we were constantly creating those like really wide bumpers. And so the idea was, everything I read said, if it's persistent and insistent, and consistent behavior. And I was like, we just like watched for it. Like, if at any point in time you don't, if you don't realize that like this is what it means, and you can always change your mind, but you're preferring to be confirmed as male. We'd talk endless hours. Like, what does it feel like in your heart? Do you feel like maybe you're a girl or a boy? And I still would buy girl clothes and always provide it for him, and provided lots of outlets to basically navigate. Because I think like a parent, you're just so terrified as a parent of doing it wrong. You're so terrified if you
Right.
don't validate, and if you do validate, you're just, and I tell all my new parents this, who are just new parents in general, like if you just come from a place of unconditional love, you can't screw it up.
Yeah.
But when there's no guidance for you, you just like know that you love your child unconditionally, and you just want to like see them be happy. You're kind of willing, you're just so open to just trying anything. And so you just constantly are just like, you're just like trying to create like really safe space and check in. And around this time, University of Washington actually started a research group researching children who identified as trans at a young age. And he was
This is
enrolled in
Dr.
that.
Wilson's study?
Yeah. And these
Yeah.
were the youngest kiddos to kind of come in, and they would just come out, and they would just interview him once a year. And this years and years and years later, he's now 12. We started following with a gender clinic at age 8. And they would just, lots of like classic things you do with kids. You're doing like behavioral health screening, just because kids in the trans population have high rates of depression and anxiety. And then we followed kind of puberty markers. And again, we talked extensively about, your body's going to start to change here in a little while. What is it you want to see happen? And we also talked a lot about that when you have a child who has gender dysphoria, you have to mature them really quickly. So you have to have these very big conversations that you wouldn't otherwise have with other young kids. Like my other child, gender's a non-issue. They don't even, he just doesn't care either way or another. He doesn't even want to talk about it. He just wants to wear sweatpants and play video games. That's what he prefers. And like can speak extensively because of the years of educating of him, of trying to be like, give him language, to give him the tools. And he just can continue to affirm like, no. And this again is after, so now we're coming up on he's 10, and he's socially transitioned for years. He's been concrete in his belief. And I've talked to parents who've been in this position too. I was like, my kiddo was easy. I mean, he just knew from a very young age. He was provided endless opportunity to be really to like offboard and like detransition. And he just like really, he was always like, he'd maybe at the most have days, we would kind of have like, we had like random nights where he would dress up in girls' clothes, and he'd be like, that was fun, but no, it's not how, I don't feel comfortable. We talk a lot about like, what does it feel right? What feels wrong? And he would say like, the idea of growing breast tissue is traumatizing for me, and I don't want that to ever happen. Wow. And he disclosed to his therapist that like he was convinced, even though we talked a lot about like what his body would look like in the future if he wanted, he was just a couple of years ago disclosed to his therapist that he was really nervous because he thought he had to get a cadaver penis. And I was like, no, that's not something that happens. So even though I spent years educating him about what his choices were, he still like had preconceived ideas of like, if I ever wanted to have like genitalia for the person I wanted, I had to like, this is how I was going to get it. And so, which again, like, I think like any parent, it's like, who is in this position, like you get a therapist, and he's been through like many therapists to just continue to talk about dialogue. I think the thing that's irritating for him, and even just like this morning, I was telling him about where I'm going to do this podcast, and it's just like gender is not something he thinks about. Like most children, he doesn't think about his gender. He's been socially transitioned for a very long time. He's a typical 12-year-old kid now. He started puberty at around 11. He was able to qualify for his puberty blockers. It was a huge fight with insurance. I was going to have to almost take a second mortgage out of my home to pay for it.
Oh, wow. So it's
And
expensive?
it's $300,000 if you get the implant. Knowing that this was going to be a blocked procedure, he qualified to get it covered, and we got put it in on Christmas Eve because I knew that this would be something that would probably be closing an option that was no longer be available to him. So we got it as soon as we could. And it might be the only one he ever gets. It lasts for a year and a half. But even though I had a child who was consistent and persistent for 8 years of his life, I still am not excited about starting testosterone. Even today on blockers, I was like, I want you to know now that you're getting older, we've got blockers on board. I want you to realize that it is always an option. If you do not feeling completely masculine, that testosterone is not something you need to start. It is an irreversible thing. There are things that are going to happen to your body that you cannot reverse. You're now old enough to kind of start to understand that I'm like, you're going to grow facial hair and that is never going to go away. Your voice is going to deepen and that's never going to go away. And we talk a lot about just because of the journey he's on, he'll never have the ability to have children naturally. There is no information out there to allow him right now to if I were to he'd have to complete a puberty to have viable eggs. And that's a heartbreaking decision for any parent or any child to know that is not options. That's not an option for him. And so blockers are also inherently dangerous. They force the body to not harden your bones hard enough. So you have to do these bone scans, and I don't want him on them very long. Even if I think the politics weren't there, I think I really would only want him on them for one treatment, because the longer you're on them, the higher risk it is.
Yeah.
It's this is all just shitty stuff. And if you asked him, when we have quiet nights and we talk about what it's like to be trans, he's pissed. I mean, that's the reality. He's just I don't want to be trans. I just want to be a boy.
Yeah.
And I think it's just hard work. It's hard work, and he's upset that he has to do it. He's just trying to navigate the world of having to tell people for safety. He doesn't like to tell any girl he's dating because he's worried he's not going to be loved. He has a small group of friends who love him and know, and we've talked a lot about the fact that everyone you've told, they just love you, and we talk a lot about how because of the way he is magical, and if he was any different, he wouldn't be who he is, which makes him so magical. But he just wants to be a 12-year-old kid. He's just started playing football, and I even was upset at that too, because I'm here he is playing football, and it's toxic masculinity, and I'm a parent who is wearing concussions anyone. And I was here's this young boy who's just so desperate to be affirmed masculine, and he's playing this part that is so classically masculine, and he's doing well, but I'm he's almost being trolled, where I can't even tell him not to do it because it's so validating to who he feels. And but it's almost to a point where his journey's been such where he doesn't even know. He doesn't even remember being female. The only thing he knows is being a trans male. He still has these beautiful feminine moments in his life. He had a girlfriend sleep over the very first time. It's a female friend. They have no intimate connection with each other. But he was able to be goofy. They did 5 face masks each, to a point where I was you have to stop. You're going to get contact dermatitis. Your skin is peeling off. And they ran around and we're goofy all night. And so it's still, he still has, and I think what was interesting too, is that when I let him finally identify male, that's when actually his femininity came out, is he felt he was finally seen and taken seriously. And it was then safe after a couple of years to sort of be goofy and show me his feminine side. And it didn't mean that he was giving everything up. And that was also too. It's
So, I want to touch on something, because, there's something that's very poignant, that you said, which is that, you sound like a wonderful mother, and it sounds like he's got amazing support from you and from other people from many other people in his life. Like there's nothing probably more you could have done that would have set him up to succeed more than it has. And it sounds like he's very well adjusted and he's doing well in school and he's got friends and, he has his moments. But one of the things you allude to is that even when things are perfect, and I don't know if you would classify what's happening with your son as like a best case scenario, but it sounds pretty close, is that it's still going to be imperfect. And you mentioned some of the challenges that he's going to face as he gets older in terms of relationships or becoming a parent or earning the trust of people around him given his unique situation. And some would argue that, if you could go back to when he's 4 or 5 and you've made this decision with him to undertake a social transition, is that would it have made sense at some point? And a lot of people will say this, that if your child is young, that you should, because, there are some data, and I don't know how trustworthy they are, that many children who are dysphoric or who are gendered incongruent will remit over the course of their childhood and eventually become cisgender, or at least identify cisgender. They might still be have some gender variant behaviors. And then if that were to happen, you might be able to save yourself some of these challenges that are going to happen in the future.
I get it. Yeah.
Yeah. And and whereas if you do undertake a social transition, there are some data that would suggest that does create sort of this path where once you commit, even though it sounds like you gave him some options to back away, that many children, once they're on that path, are going to stick with it because they don't, once you're on a path. Yeah. So how do you know, like, I know we never know whether we made the right choice or not, but like, is there something that sort of, like, did you ever consider, we better just tough this out? I know my son is struggling with not being male and struggling with, being a girl, even given you having this very expensive role for womanhood. Did you ever just sort of say, no, we have to put our foot down at least at that, because there's a chance that this will settle or stabilize and then he can go on and live as a girl and develop as, physiologically as a woman and have whatever people envision a full life as a woman would be?
Yeah, no, I mean, I think I always, you don't ever want your child to, it's really hard being different, and you just don't ever want you don't want your kid to have to not have a choice in being different. And I for sure looked for every single opportunity to where I could maybe get a hint that like, maybe we were not trans. I was like, I was like almost to a point where it was like a neurosis, and like some of the things I used to read, and this is like totally not even evidence-based, but I used to say, read some things early on. It was like, if they don't change their underwear to the preferred gender, they're not really trans. Or it was like, or if they wear a swimsuit that's in their birth gender, they're not really trans. And so I'd grab onto that, and I'd only buy female underwear for a while. And he refused to
You were
underwear.
trying to test him almost.
Yeah, I was honestly, if I just don't provide male underwear, maybe he won't, if it's just, maybe he's still a tomboy. And yeah, his way around it was he just stopped wearing underwear. He was like, I don't need underwear. And
oh, wow.
I didn't provide, and I used to provide I provide more of a feminine swimsuit. So I'd put a rashie and some swim shorts, and he just didn't go swimming. He was and so it wasn't, and I think that's what this concept of if we just don't promote it in our kids,
right.
I don't know I don't create children that are passive. I can't get my kids to eat vegetables. I can't get in the fucking room. Right. I do not have children that I can I can try to buffer them, but I know there's children like that are really influenced. That is just not my child. I have both my children who are just empowered and determined, and pushing has often resulted in significant conflict. So it is a situation of really, choosing my battles. Now, obviously, my oldest now is a point where just developmentally, his brain is a little more when kids are young, they're very concrete in their thinking. At least mine are very concrete in their thinking. Until they get older, that they get social pressure and they can kind of like question things and like maybe consider stuff. And my oldest is now at a point where he can kind of sway him in certain ways, but it'd be like having a conversation, trying to change your cis child to a different gender. It's about that challenging. Like if I have this little boy and I just really want him to be a little girl, and you're like, well, what if I give him the clothes, or I start talking up girls, or if I just tell him he can't be a boy anymore? It'd be as odd as if I had a cis-born male, and I just decided I wanted him really, really badly to be a girl, and he just would be like, "You cannot see me." And it just ultimately, I think, like the times when, there was a couple was there where when I tried to force it, it got really ugly. Like my sister was getting married, and there was some suggestion that he should wear a dress, and this was one of the first few years after he had socially transitioned, and it was like he had all but refused to even go to the wedding.
It's just not going to happen. Yeah.
He was just like, he's like, trust me. I mean, he's like very much that child. He's like, hold my beer. I will ruin this day for everyone. And and he wore a beautiful tuxedo. He was charming and adorable and waltzed down that aisle. That was our big test. It was like, that was the first time where we had socially transitioned, and it was kind of all play up until that point. And it was the moment where we were going to take big family pictures, going to be sent out to everyone. And everyone knew that I had a little girl, and the previous wedding, my middle sister got married. He had shown up in a dress. And so it was a very defining moment. And and we had tried a couple of times, and it just became very evident that this was like not going to be successful. And again, those like things you're like it's not, I mean, a tuxedo is not bad. Like, what is a tuxedo? What damage is it going to do? I mean,
Right.
Like I'm getting married in a tuxedo.
What about the parents, and this is probably not healthy parenting, but the parents that say like, oh, well, if your child, demanded that you let them step out into traffic, or if your child demanded these things that are just unhealthy for them, it's like you're just soft. You're just giving in to, you got to force your kid to eat the vegetables, right? Like, did you ever have moments where you felt like that? You felt like, no, like I need to. And did that ever backfire, or like how do you contextualize that kind of that kind of authoritarian approach?
I didn't. I mean, I would say like because I guess I also read I read the data, and I read a lot. By this point, I was pretty well versed on when gender dysphoria can present and how it looks, and I felt pretty comfortable with the medical knowledge that I was like, I think at that point I was like, I'm getting like, much like when I'm diagnosing somebody, I'm like, I am checking all the boxes here. Like this is, if I try to make this something that it's not, I'm just like in denial in my mind about what I'm actually seeing. But again, that I think I come from a place of privilege in the sense that I don't have fear behind allowing my child to present in their preferred gender. And I'm capable of understanding the literature around it and interpreting that. And I'm capable of understanding the risks and benefits of all my different decisions. And so as we talked earlier about being an informed patient, I felt like I was able to be a really informed parent. Yeah. And I felt that the risk of not supporting my child outweighed the risk of supporting him. And I knew that I was always going to be paying attention, just like I do in any kind of like with all my patients and all their medical care. Like we make a decision, and we're not making a forever decision. We're constantly checking in and navigating. We can always change our course, and we're just like collecting data. And if at any point in time it felt like I was like, I think this is wrong. I don't think this is true. I would have pushed it. And there were a couple brief moments where I was like, I don't know if this is true. And we kind of explored it a little bit and pushed it. And he just was like, and he'd maybe like entertain it for like, we'd have like a dysphoria for like 2 weeks. And then all of a sudden he'd push back and be like, nope, back at it. And so I think that's, and I think that's something that just like as a parent and most parents of kids who are trans, and I've talked to a lot of parents who have very conservative views and they bring their kids in, they know their child.
Yeah.
And they know what's in their heart. And they either choose to like meet their kid where they're at, or they choose to not. And I think that the parents who are, or the people that say that like, oh, you're just providing space for your kids, I think are just like not parents, or they have never raised a trans child. And that's like what it comes down to, is it?
Well, I mean, it's like you said with your kid, he doesn't want to be trans. You didn't necessarily want them to transition. Like,
no, yeah,
I'm
like,
trans. We're all parents here. Like, so
yeah.
I have a daughter. I would struggle with everything that you're saying you struggled with. And I'm pretty sure, Laura, you would feel the same.
Yeah,
like if one of your young kids, just like we struggle with kids eating the vegetables, or like you want to do the right thing, but are you causing more harm trying to force your will upon them?
I've talked about this on one of our previous shows, because my youngest are 15. And if, even though I'm very pro gender affirming care, or at least availability, if my own son came to me tonight or tomorrow and said, I've been having these feelings, I'd be like, well, we're going to talk about this for a while before we do anything about it, because I know what that path is like.
Yeah.
I know what.
Tell me what underwear you're going to choose. No.
Yeah. At least change it once in a while.
Yeah. And I think it is like, and I think you, as a parent, you know how kids' brains work. You're like, oh my God. And being the doctor for a lot of these teenagers, I'm like, darling, you don't know what you want for dinner. Nevertheless, what you want for your life. I mean, I think, and I think that's again but our job as a parent is to provide safe space for our children to grow up. You bring your expertise. And I will say, I mean, my oldest is he is, I don't want to say he's a defiant pain in my ass, but he knows, he like has to learn the hard way on everything. I'm always having conversations. I'm like, you never take my advice. You just have to like do it on your own and learn the hard way. And it's like, but this is something into, and I know, and I think you also too, when you parent your children long enough, you learn that like, he doesn't ever commit to anything too long. Like when he gets like ideas, he'll be like, what did he want? He wanted those like stupid video game that you wear.
Like the VR.
The VR headset. He's like, I need this VR headset. It's all I ever want. And he just would like beg and plead. And I was like, fine, I bought it. And he instantly gave up on it.
Yeah.
And I was like, and so I think that's where even with like him, but when he talks about his gender, it's a different energy. Like it's not like that.
This is your non-trans child.
Oh no, this is my trans child.
Okay.
So yeah, like when he'll get obsessed about things, or he'll become like, he'll be like, he'll need the new shoes, and
like
the
the impulsivity.
Impulsivity and like the reactionariness. Yeah. That is not the conversation he has when he talks about what it's like to be trans.
Right.
And we talked a lot too about like what it's like to be in middle school with kids who are all of a sudden are exploring their gender. And he's like, honestly, he's like frankly annoyed by it. He's just like, well, I'm not going to like talk to them as far as like coming out and disclosing who I am. He has a very sobering energy when he talks about what it's like. And a very mature.
Not looking for the drama around it.
Yeah, he doesn't. Yeah, it's not about. Yeah, and it's not about. He doesn't want to ever entertain it. He doesn't want to spout it from the wall. And obviously, a lot of that is, I think, us and just being really careful about trying to keep him safe and things like that.
So we're living in like, you start off with the climate about like these really scary times, I think, for any trans people, but especially for trans kids. And, you sort of alluded to it earlier that he's not yet on testosterone, but it's something obviously you're considering in the future. You live in the United States where questions about access are up in the air a little bit. I know the state you live in is more liberal, but who knows how much power the federal government is going to wield. How what you're going to be dealing with this with your own child, but also as a physician, like what advice are you giving both to yourself and to your parents about like how are you going to handle it? Let's say if the States does put in a broad ban and saying no kids can have puberty blockers or cross-sex hormones, as is the case, I believe, in 30 states now.
Yeah.
How are you going to approach those types of conversations, or are you just sort of like keeping your head down and say we'll cross that bridge when we come to it?
I think I mean, I think like I have a lot of different game plans. I think like any parent in this position, you've sort of like you've filled all your reservoirs of opportunities. Like I had his birth certificate changed to keep him safe from them enforcing kind of some school enforcing like gender pronouns in schools. Not that they've passed that, but I have looked to see if I had could we move abroad if we had to, just for safety reasons. I obviously I am not worried about my position. I am a person with means. I
Yeah.
worry about and I've told my family that, I worry about the other kids I take care of who are currently, like the other young teenagers, like the, 18-year-olds or the 17-year-olds who've just started hormone therapy and are doing well and are going to like lose access, or on blockers and are going to lose access. I think that's kind of where I stand on. Yeah, I think it's, and just like really trying, you're constantly, I mean, I think like when you're being oppressed, you spend your nights thinking about ways to break out of that jail. I mean, that's like, I've thought about like joining religions and like, and suing people and like all kinds of like creative ways to like force the river in directions that, to make things work for us. And I think there's this one religion, Unitarianism, that like supports, and I was like, oh my God, what if I take a religious stance? Like if they were to force us to, change pronouns, what if I took a religious stance and I sued the government? And I told my son, I was like, we have to join a religion. He's like, and he's totally against like organized religion. He's like, you're
wow.
crazy. We're not joining a religion.
That's so funny. Well,
But
we're right at your.
yes, I have to wrap up. Yeah.
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 So if you don't mind, just last word, like, is there anything you wanted to say to folks that in general about what we talked about, or is there anything you want to leave us with? Usually a positive message would be great, but
Yeah, I think it sounds really funny, but I tell my child this, that I'm like, people try to oppress the only things they're scared of. Like no one's worried about the people that don't threaten them. No one's trying to pass laws to oppress people that don't threaten them. We've made a lot of incredible progress in our country in the last 20 years and in this topic, and that is not going to go away. And there's a lot of people who are huge advocates of this population, and it doesn't seem like they are right now because it's just they're busy like doing the work. They're busy like taking care of people and supporting people, and but I think that people think that we're going to slip. And I know just like today, like I just found that, yeah, like I can't continue to practice at my clinic. But there's a free clinic around the corner. I can practice at. And so, it's just like, I think that it just takes like all of us in this position who are advocating is that it just takes a little bit of creativity and elbow grease. And at the end of the day, it's bad, but we've been worse. And I think, we're a country that doesn't like oppression at any level. Doesn't matter what it's for. So I'm hopeful. I think I'm not as of right now. I have no plans of leaving my country, and we are a thriving family, and we're safe, and we have an incredibly supportive community. And we're a purple community. We have an incredibly supportive community, and I think we're kind of like, I think we're normal America. And I think that's what I get reassured. I think it's really easy to get stuck online and think like, oh my God, everything's so bad. And then I look around at my very purple town and I'm like, and we're fine. Like the average person is just is honestly a kind person and
Yeah.
just really wants what's best for everyone and has no really strong feelings. They're like, I just want to like go to the grocery store and not like draw out my paycheck. And
Right. Yeah.
I
Yeah.
just want access to healthcare, and they're not like social issues. They're kind of like, they're like, I'm just trying to like make a living. I don't really care about social issues. And so I think that's, you know, the
Oh,
reassuring thing.
well, thank you so much for your time and coming on
No,
here. I
absolutely.
really appreciate it. Laura, did you have anything else? Otherwise, I think we can let it
No,
go.
no, I thought, I just want to say it was really, it's really beautiful. I can share your story. It gives, I know our show goes out to a fairly wide audience, including probably some parents who are in the same situation you are. And I know that, if you spend too much time online, it can feel hopeless. And hopefully, with hearing your story, it gives people some hope, for the future who might feel that sometimes like the world's crashing down. And I also hope that for some people who are more skeptical about sort of children who are transitioned and about their health and their well-being can also hopefully have an open heart and open mind to
Yeah.
hearing your story.
I think at the end of the day, we all just want, like anything, it's like we all kind of just want what's best for each other. And I think that the things that get the most attention are the oftentimes the most atypical, and that goes across the board. It goes from like people who hate the trans community get a lot of attention, but are a very small population of people. And
Yeah.
the people who tend to like give a bad name to the trans community are get a lot of attention, but are a small population. The bulk of us just like
Just in the middle,
want
stuck in the
just in
middle.
the middle.
Yeah,
Yep.
like yeah,
I'm just trying to get
most people don't
yeah.
care.
Yeah, most people don't give a shit. Yeah, we're all trying to just make it. So
Yeah.
yeah.
And if they happen to know
Definitely.
someone they like who's in that situation, it's sort of like, okay, well, I think it's
Yeah.
fine. If you're a good
Yeah.
person, I'm sure you're doing the right thing.
And if anything, they just like, I think it's more of a, and we're at a time too now where they like, if it's getting attention, they're like, oh my God, that is heartbreaking. And they want to like, what can I
Yeah.
do? How can I protect you?
Yeah.
And that's important.
Well, it's
So,
everyday stories like yours that really help
Yeah. Like
yeah.
put that into perspective. So I want to
that's why
thank
we're
you so
trying to do this
much.
show. Just to,
Yep.
yeah.
It's completely normalizes it. Cause that is the bulk of, yeah, I was like, I feel like I see it, I have a big enough finger on the pulse of this local community. And it's like, I was like, this is so normal. We're just like a bunch of normal people in this country. And it's, yeah. So anyway.
Awesome.
Well,
Well,
thanks so much. We'll let you go.
Absolutely. All right. Well, have a good night, you guys.
yeah, it was
Enjoy
really
the
great to
football
meet you. And if you ever want to talk again, love to talk to you about the show
I'm
or
always
otherwise.
happy to be on for sure. It is
Yeah.
like, I think this is such a great thing that you guys are doing. So I'm totally happy. Anytime.
Like I said, here, like for people who are more skeptical, or I think a lot of people who are against sort of pediatric transition, get this impression of like the kind of parents who transition their children as being sort of, like the misconception I think is that they are like they're crazy people who are forcing their kids to
Pageant
take
moms is what I'm
pageant
calling
moms,
it.
or they call them
Yeah.
Munchausen's by proxy, uh,
Yeah. Well,
and
to be honest, I had sort of a jaded view of that too until I met her in Amsterdam and she started telling me these things and I was like, "Oh wow, like
yeah,
it's so refreshing to hear." I mean, I know that there's parents with trans kids that are good people. That's not what I mean, but it started to feel like there was more of an overwhelming like a lot of celebrities with trans kids and social contagion. You just it starts to muddy the waters and you start thinking, well, is that what's happening? Like, and then you hear a story like hers and you're just like, oh, thank God. It's just a parent that
yeah.
loves their kid,
It's
you know?
no, but like because and I don't know if you had a chance to read it because I know you've been out and abroad. Or I wrote an article on I put it on Substack, which sort of tackled this issue a little bit. And in what I wrote, I was sort of very kind of lukewarm on the idea of pediatric transition, but I sort of left the door open for, if your kid is doing really poorly and really insistent that it probably is the best choice, to allow them to fully enact a social transition, really take on pronouns, and everybody starts
Right.
seeing them as a boy if they were born a girl, or a girl if they were born a boy. But one of the fears that I still have is that there are some parents who are well-meaning. They're not crazy people who have a child who's like a little bit gender variant, maybe prefers, is born a girl, but prefers some boy toys, but isn't necessarily expressing discomfort, or a girl, or born a boy who prefers girly things, but isn't necessarily expressing discomfort, where there's sort of this either internal pressure, or someone says, well, maybe your child is trans and you should let them be a girl and you should let them be a boy,
Sure.
that they do this, even though for that kind of more milder kind of dysphoria, or where it's just a little bit of variance, where if you let it go and let them, like, if you let them play around, they'll eventually settle in back on their birth gender and maybe turn out to be gay, but will still be able to have an intact body. And I still think that's like kind of the best possible outcome if you can pull that off.
Of course.
But
The least invasive, the least harm, right? Like,
yeah, but
yeah,
clearly there are some kids where that's just not going to work, and to try to
sure.
force them all the way through to adulthood to live through a role that they don't want to be, and eventually go through a puberty that they don't want to have,
Just to transition anyway.
just to
Yeah.
transition anyways, or to be at that point where they turn 19, and let's say they are like a natal male, and because they've gone through puberty, now they're 6'3" and they're broad, and they have, like, where to transition like that becomes a very different proposition than what would have happened if they would have
Sure.
started when they were 12 and they would have ended up 5'6" and narrow and what. And I know looks, we always like to say looks don't matter, appearances matter, it's what's in your heart, but we all know that the less typical you appear, the harder a go it's going to be. And so you're right, like, if someone is going to be predestined to transition anyways, why put them through that torture?
Yeah. I think it's one of those things where I think most people that are unsure or hesitant is like, well, if there was a swab test or something, right? Like something that just
Yeah.
positive, negative.
Yeah.
Okay, you've got the trans
You
bug,
got
and
trans.
now you need to
Yeah.
get treated by, it's like, gosh, that would be nice if it wasn't so squishy and mental, when it comes to understanding it.
Yeah, no, like I don't think there ever will be a test, and I just think the best decision, like I said, but my children are older, but if I was faced with this situation, I'd probably do exactly did, which is like just open it up, let the child sort of choose,
Yeah,
and only really commit to a social transition if it's become so clear that it's damaging to keep them in their role.
definitely.
But you're always gonna have people second guessing you, and you'll
Yeah.
probably also be second guessing yourself.
No, I agree. I mean, just like she said, like, son doesn't want to be trans. I didn't want to be trans. I don't know how you feel, but I'm guessing the same. Like, you would rather be cis.
I'd rather be cis. Like,
Yeah.
I used to be very apprehensive of saying something like this. Like, even looking back, if, like, I always used to say, well, even though this is a difficult life, it's the only one I would have chosen. At the same time, if someone would have told me, let's say when I was in my early 20s, that if you undergo this course of treatment, that it'll make the trans go away, and you could just go on being a cis guy without any dysphoria,
Right.
and I would have been like, yeah, fuck that. Like, I don't need
Same.
to over
Yeah.
my head.
Or if I
And
could have just been born one or
well,
the
first I
other,
could
one
just
or the
want
other,
to
right?
find out.
One or the
Yeah,
other, but
yeah,
but one or the other, just cis. Like, I didn't care if I was male or female in the sense of I needed to be trans. I just wanted to be what felt the most comfortable,
yeah.
right?
Like I think I've made the best choice I could make in the situation.
Exactly. Yeah.
Like, I think if, like, I have no desire ever to detransition. It's never sort of crossed my mind. Um, I'm pretty sure that if I hadn't even made it to, I'm 52 right now, that if I couldn't even envision what that life would have been like to have been a male for the last 25 years.
Right.
So, like, I think I did the best I could given the choices I had, but I would have rather not had been in the position to have to make that choice.
Yeah.
Like, if I could just been normal dude and been like, whatever, I think that would have been like easier, obviously.
Sure. I mean, I'm at the point, and I'm only, what is it, 25, 23, 28, 24-ish. I still can't even imagine even the last year and a half or 2 years even
Yeah, no,
have
it's
not
just,
having not transitioned because the way it feels now versus then, it's so night and day, and it's so eye-opening. It's like, oh my God, like, this was clearly right. Now, at the time when I was making those decisions, I was still kind of like, well, I really hope, and I'm not sure, and step by step. But now, being more on the other side of it, I'm looking back, and it's like, yeah, at first I was hesitant, but like, if I had known how I feel today, then I would have chosen right away to transition.